One of the cornerstones of concussion diagnosis and management is assessing the types and magnitudes of observable signs and symptoms the individual is reporting. Observable signs are behaviors someone can observe, such as individuals having a blank vacant look, loss of balance, loss of consciousness, and sometimes seizures. Reportable symptoms are symptoms that the individual may tell you or complain about, such as headache, dizziness, confusion, or light sensitivity. A commonly used tool to assess concussion signs and symptoms is the Graded Symptoms Checklist, otherwise known as the GSC. The GSC tracks 22 commonly reported concussion symptoms, and the concussed individual will rate the magnitude of each one on a 6-point scale. Tracking symptoms is important because of the types of symptoms and intensity of symptoms may change over time. The GSC may be downloaded on our website, hawaiiconcussion.com. The signs and symptoms of the GSC can be further categorized into 4 categories which make up the symptom wheel: physical, cognitive, emotional, sleep, energy. A very important point to understand is that the 4 categories interact and affect each other. For example, physical symptoms will affect cognitive symptoms. Headaches will affect someone's ability to concentrate and remember. Another example is that the concussion has been shown to affect an individual's sleep pattern. Poor sleep will affect a person's emotions, where they become more irritable, their physical well-being, where they may report more headache or dizziness, affects their ability to concentrate, remember, and also their processing speed may become slower, and also report more mental fatigue. A basic understanding of these 4 categories and the signs and symptoms may help the educator create school adjustments for the concussed student in the classroom. During the early days of concussion, the brain is in an energy crisis. This energy crisis is caused by a biochemical imbalance in the brain, which is thought to cause the physical symptoms. Concussed students should be removed from physical activities, classes such as PE, dance, marching band, without penalty until cleared to return to physical activity by their physician. Some common classroom adjustments that addresses physical symptoms are to allow strategic rest breaks, where the student may be allowed to rest for 15 to 20 minutes in the school nurse's office or in a quiet room. This will help the student to recharge and possibly control their symptoms. On Karen McAvoy's Get Schooled on Concussion website, the main principle on Return to Learn is reduce and remove. As I mentioned earlier, during a concussion, the brain is in a state of an energy crisis. And as an educator, one of the primary questions one can ask when dealing with cognitive symptoms are, how can I temporarily reduce the mental demands on the recovering student whilst helping them learn over the next 3 to 4 weeks? Another question you can ask yourself is, can you exempt or postpone exams? Can you focus on quality of learning rather than quantity? Some other questions you may want to consider is, can you allow 5 to 10 minutes of refueling time for the student? And also, can you reduce in-class or homework or repetitive work? Since every educator's teaching style is different, method of delivery is different, subject matter differs, it is important to ask these questions to determine how classroom adjustments can be provided to a concussed student. It is not uncommon that concussed students may become more anxious or nervous. Concussion recovery is highly individualized and may be frustrating. Communication and observing the students for out-of-character behavior may be necessary. Studies have shown that reassuring and communicating a plan reduces anxiety, nervousness, and depression symptoms of concussed students. Sleep is considered one of the most important recovery tools that the concussed student has control over. Poor sleep hygiene can have a negative effect on physical symptoms, cognitive symptoms, and emotional symptoms. It is recommended that concussed individuals get 8 to 9 hours of constant sleep. Frequent and long napping should be avoided. On a daily basis, if possible, educators should check in with their concussed student, asking him or her 3 questions. How are you doing today? Tell me more about your symptoms. How can I help you more? Also, educators should seek out campus resources who may also assist in classroom and school adjustments, such as the speech language pathologists and counselors. Another resource that is available is the Teacher Acute Concussion Tool, or TAC. TAC is an online resource that you may use when you have a concussed student in your class. TAC will send you weekly emails for 4 weeks on guidelines on how to manage a concussed student. TAC also has a library of quick reference, one-pager resources on concussion and return to learn topics. This is an example of the TAC one-pager on the symptom wheel. To gain access to TAC, ask your high school athletic trainer or contact HCAM at info@hawaiiconcussion.com. If you want more information on concussions and return to learn, please visit our website, hawaiiconcussion.com. Thank you.